A very busy day at ASH 2013 in New Orleans. Happy to have with us from his busy schedule, Dr. Matthew Davids, attending physician in the lymphoma program at Dana-Farber and an instructor in medicine at Harvard Medical School. Thank you, sir, for stopping by.
My pleasure.
So you're active in research in CLL. Tell us about that.
That's right. So my research focuses on CLL as well as non-Hodgkin lymphoma, where we're trying to develop novel therapies to help our patients.
What do you have going here at this conference?
So at this meeting, I was able to present the interim data for a drug called ABT-199 in patients with relapsed and refractory non-Hodgkin lymphoma. This is an exciting new compound. It's an oral drug that's a selective antagonist of a protein called BCL2. BCL2 is fundamental to the pathophysiology of lymphomas and also probably confers resistance to chemotherapy. So it's a very exciting opportunity at this conference to share some of the interim data from this first-in-human study.
And what is some of that?
So this study included patients with a variety of different non-Hodgkin lymphomas, including some of the common ones like diffuse large B-cell lymphoma and follicular lymphoma, and some rarer non-Hodgkin lymphomas such as mantle cell lymphoma. What we've found is that there's been activity across the different histologies, and so the drug seems to be active against a number of different types of lymphoma. As a first-in-human study, of course, safety has been a major thing that we're looking at, and the drug does seem to be quite well tolerated in this group.
What do you think is the impact of what you found so far?
So far, I think there's been a very strong signal of efficacy, particularly in mantle cell lymphoma, a disease that can be quite challenging to treat in the relapsed refractory setting. So I think it's going to be interesting to explore the activity of the drug in a larger patient population in future studies.
How will you do that?
So there's already additional studies being planned both in the monotherapy and in the combination setting with chemotherapy. And so the disease-specific cohorts for this study will be opening hopefully next year, and we'll hopefully get a better idea of the actual efficacy of the drug in that setting.
Okay, you can come back and join us then.
All right, sounds good.
Thank you, sir.
Thank you.
Dr. Matthew Davids joining us from the lymphoma program at Dana-Farber here at ASH 2013.